Everyone, please join the quiz using the link that is provided in the comment section. Also, the link will be shortly shared in the Telegram group. Also, the link will be shared in WhatsApp, Dr. R&D WhatsApp channel. Everyone, please join the quiz as soon as possible. We'll be starting the quiz exactly at 10 p.m. We have 10 more minutes to go. Please join the quiz. The link for the quiz is given in the comment section of YouTube live video. Today we'll be having total 20 questions. So this quiz will happen for a bit longer time because today is grand finale. Over the past 1 week, we had topics segregated into various topics based on priority. So we had completed surgery. Okay. Okay, so we are getting comments on are you ready for JuxtaMed surgery quiz? And yeah, we are getting comments like yes, no, believe myself, really motivating. Yes, you can type whatever you want. Nice one, thank you. So today we are having surgery JuxtaMed grand finale. Okay. So thank you for the comment that it's a nice initiative. We appreciate your feedback. Quiz will start exactly at 10 p.m. So join the quiz as soon as possible. Right now we have 17 people who have joined. I see that many students are getting benefited from this surgery quiz. So today is a grand finale. I guess have you guys finished your topics? Like over the past 6 days, we had various topics segregated. Okay, so based on priority. So I guess you guys have finished the topics already. Yes, this was meant for procrastination. The problem is students don't study a given topic in a given amount of time. Okay, so you start to postpone those topics. So we developed a mechanism so that you guys can be accountable. Okay. So that was the whole idea behind this JuxtaMed quiz. Okay, we'll be having psychiatry. Okay, today we have general surgery, so we'll be having psychiatry also. So don't worry, we'll be covering all the topics. Let's see in the YouTube comment section if anyone has asked any doubts. Okay, link for the video is given already in the YouTube comment section. Okay, so join using the link that is provided. Also, one more announcement, a live mentorship session. Tomorrow we'll be having session at night 9 p.m. So those who have enrolled for live mentorship session, we are informing right now that there will be live mentorship session tomorrow at 9 p.m. So any doubts related to NEET PG or INICET, you can ask me directly tomorrow. So after this surgery, we'll be having ortho. Okay, so ortho will be having for 3 days, and then we'll be having OBG. Okay, so ortho will be having on 27, 28, and 29th. Okay, 3 days we'll be having ortho, and then we'll be having OBG. So we'll be continuing this till 28th of February, and then we'll be having the rest of the 9 subjects. Right now, we are covering up 10 subjects. Okay. So I'm getting feedback that it's helping me stay accountable, sir. Thank you for the timetable and quizzes. We are very much happy that this new idea of making you accountable is helping you a lot. So we hope you. Okay, so Vishnu Priya is asking, so today we are having psychiatry also. No, no, we are not having psychiatry. Why is this doubt regarding psychiatry? We are not having any quiz on psychiatry. Okay. Psychiatry is at last from 26th of February to 27th February. Okay. It's not 26th January. Till 26th January, we have surgery. 27th January onwards, we have ortho, 27th to 29th. Yeah, competition is huge. Okay. So competition is huge. Okay, let's see how many of you have joined. Okay, so 31 out of them joined. Anyone who hasn't joined, kindly join first because we'll be going to shut the quiz in next 2 minutes. Okay. 2 minutes to go. Anyone who joins in middle can directly join the quiz. Okay, there's nothing like that. You can directly join the quiz. Today's questions were prepared by my team RMD. So I have a limited knowledge in surgery. So pediatrics question I had contributed, but for surgery quiz, I have literally no idea regarding it. Okay. So we'll be seeing what those questions are. I'm also new. Today my team is not available due to some unforeseeable circumstances. So I'll be hosting this quiz alone today. So 2 more minutes to go. Those are ready to join, join quickly. So Vishnu Prasad sir, how to complete some backlogs? Yeah, whenever we are organizing this grand finale, okay, those are the days on which you can cover up your backlogs. So Sai Krishna sir, will there be any buffer days in the schedule? Right now we haven't kept schedule is tight. Okay, but in between for long subjects, when you have this grand finale, that time you will be having buffer. Okay. So 1 more minute to go. We'll be starting soon. Also, one important announcement. Tomorrow at 9 p.m., we'll be having Dr. RMD live mentorship session. Access is limited to members only, those who are enrolled themselves. So if you haven't enrolled, go to Dr. RMD YouTube channel and enroll yourself, join the membership program, and then you'll be able to enroll in that. There will be direct interaction with the participants, and the guidance will be given regarding NEET CT, INICET on individual basis. Okay. So I think we are good enough to go. So let's start this session. Hello, everyone. So welcome to this JuxtaMed surgery grand finale. So here we are for surgery. So over the last 1 week, we had seen many surgery quizzes. Total, we had 6 topics segregated over last 1 week. So today we are here for Okay, so today here we are for the grand finale. So welcome everyone. Those who are ready to join, kindly join as the time passes by. Okay, you can join the quiz anytime. So after getting so many comments regarding if you are ready for the JuxtaMed quiz, and there are so many comments here. So after that, yes. So let's proceed ahead. So here comes your first question. Okay, so let's move on. The first question is, reverse Trendelenburg position is commonly used to improve surgical access to which anatomical region? So if you were monitoring our quizzes daily, if you were participant daily, then you would have noticed that this question was asked in the general surgery part of the quiz, and this is a very important PYQ. So your time is up. Let's see how many of you have answered this correctly. Yes, it's abdominal region. So this we had discussed during general surgery quiz also. So those who have got it wrong, either you didn't prepare during that time or you made a silly mistake. So this mistake is not to be repeated in your NEET PG exams. Okay. So we have Myra leading, followed by Soumya, DR, Ashish, and Shamili. Okay, moving on to the next question. Today we'll be having 20 questions. Okay. So which type of suture is commonly used to secure a suction drain to the skin? Okay. This again is a question repeated from general surgery. We are asking repeated questions because these are the PYQs which are commonly asked. Okay. It's not that we are repeating same questions and again because these questions again and again are asked in the exams. That's why you need to know these questions. Without knowing these questions, it is definitely not possible to like crack entrance. Okay, so the key success to cracking entrance is to answer most commonly asked questions. You can never make a mistake. It's a crime to make mistake in a commonly asked question. So whoever has answered Vicryl, those 9 people and one chromic catgut, you should improve your basics. Okay, so Myra is leading, followed by Soumya, DR, Kavita, and Vanji. So moving on to the third question. 52-year-old male presents with venous ulcer over medial malleolus. Duplex ultrasound shows reflux in the great saphenous vein. What is the best initial treatment? Okay. So you have 4 options. Again, vascular surgery is a repeatedly asked question, especially from varicose veins and questions related to aorta and arteries, okay, peripheral vascular disease. These are repeatedly being asked. So if you don't focus on this, again, you are not going to crack entrance. The main point of this video, of this quiz, is to make sure that you get on strong with your basic concepts rather than focusing on rare things. Yes, so the answer is compression therapy, which most of them have answered rightly. Moving on to the leaderboard, Myra is leading. I guess Myra has come prepared, followed by Soumya, Rakshaya, Mahesh, and Shamili. Moving on to the fourth question. So a 30-year-old male presents with a swelling in the groin that increases in size with coughing. Very important history. On examination, mass is palpated in the inguinal canal. Now your question is, which of the following structure is most likely to be found in the inguinal canal in this patient? In other words, what are the structures that are present in the inguinal canal is what the examiner is going to ask. So two things are connected here. One is clinical history, the other is anatomic. So surgery plus anatomic question. If you have done your internship or during your MBBS days, during your surgery portions, if you have read properly, then you can very well answer this question. So most of them answered it right. It's ilioinguinal nerve. Okay. So Soumya is leading right now, followed by Rakshya, Maira, Vanji, and Shamili. Okay, so the so the difference is not much. Everyone is close. Like second and third position, it's the same marks. Okay, so there is cutthroat competition. Moving on to the fifth question. 60-year-old male smoker presents with claudication, erectile dysfunction, bilateral buttocks buttock pain with worsens with walking. His ABPI, ankle brachial pressure index, okay, is significantly reduced. Which of the following is the most likely diagnosis? So a straightforward question, and I think option 3 and 4, I think it's a glitch. Both of them have same options. So I think both of them have same options. Yeah, so I think this is a glitch. So the answer I think is very clear. It is Lerich syndrome. Okay, so even though both the options are the same, but still bilateral buttock pain. Okay, and erectile dysfunction focuses like points us towards atherosclerosis or the stenosis of iliac arteries. Okay, leading to Lerich syndrome. Okay, so Soumya is leading, followed by Rakshya, Maira, Vanji, and Shamil. Good. Next, moving on to sixth question. 55-year-old male with history of cirrhosis and ascites presents with increasing shortness of breath and right-sided pleural effusion. Pleural fluid analysis reveals serum to pleural fluid albumin gradient of 3.2 and fluid is low in protein. So what is the most likely diagnosis? So a classic clinical question, liver disease with ascites, probably decompensated liver disease, presents with increasing shortness of breath. The cause is right-sided pleural effusion. Okay. So in pleural fluid, you are getting this gradient of 3.2, which means the serum is higher and pleural fluid is lower in albumin. So it is a hydrothorax due to cirrhosis. In other words, it's a transitive pleural effusion, which is the answer. Okay. So if your clinicals is strong, okay, if your concepts are strong, then you can get it. So tuberculous pleuritis, malignant, these both causes exudative type of effusion. Okay. So I think Hemant has got it wrong. So I can see sad emojis from Hemant. So Soumya is reading right now with the longest streak, followed by Rakshaya, Myra, Shamili, and Mahesh. So the top five is pretty much the same. Moving on to the next question. What is the primary use of DMSA, that is dimercaptosuccinic acid in renal scan, okay, DMSA scan in clinical practice? So this question from urology is repeatedly being asked also in pediatrics. Okay, in pediatrics, this concept is important to identify yeah, the renal damage or renal scarring that is caused. Okay, so for that purpose, we'll use DMSA. Okay, this DMSA will tell you what is the function of kidneys. Okay, it's a functional. This investigation is used to assess the function of the kidneys. Okay, so the answer is anatomical details of the kidneys, which is the right answer, and almost everyone of them has got it right. So leaderboard shows Soumya is still leading, and top three remain the same. Moving on to the next question. 16-year-old male presents with sudden onset severe left scrotal pain and nausea. Very important. Elevation of scrotum relieved the pain. Okay, so what is the most important? What was the most likely diagnosis? So again, a classic clinical question. If during internship or during your UG days, if you had gone through these cases, like a patient coming with a young patient, 16-year-old coming with left scrotal pain and elevation of scrotum relieves the pain. This is a classic clinical case scenario. And you'll see that in recent in 2024 NEET PG, most of the questions that are being asked are clinical based scenarios. Okay, so if your clinicals are strong, if your concepts are strong, you can answer this question. The answer is echididymo orchitis, and majority of them have answered it right. Moving on to the leaderboard. Soumya is leading, followed by second Myra, third Vanji, Shamili, and fifth we have him. Moving on to the ninth question. Following a mass casualty, how would you triage the following patient? So you have to match this following, okay? So there are four columns on the right side, that is black, green, yellow, and red, and you have to match them with the patient case scenarios, okay? So patient presents with laceration on the forehead. So what will you mark? Will you mark green, yellow, red, or black? Second is patient with 85% second degree burns. Third is a patient with tension pneumothorax, and fourth is a patient with degloving injury. Okay. So basically, this question is based on triage. This is a PSM question as well as a surgery question. So if you know how to triage patients, then it is easy to identify the answer. Okay. So patient with the least injuries should definitely get a green, and the most serious should get red, and the moribund will get black. Okay. So let's see the leaderboard. Yes, almost everyone has got it right. Soumya is leading right now, followed by Hemant, Aisha, Shamili, and at fifth place we have Vanji. Next question on the screen. We have been halfway through the quiz. You have to identify this. I guess the participants can see the image. I guess the audience can't see the image because of this glitch. So you have to identify this image, whether it is a CDA, that is congenital diaphragmatic hernia, or whether it is congenital hypertrophic pylori stenosis, or it is TOHE or HPV. Okay. So identify this image. 15 more minutes, 15 more seconds. Participants can see the image, I guess. Okay. But the audience who are watching on YouTube live, you can't see the image. Okay, everyone has answered it right. The image was showing CHPS. Okay, so Soumya is leading, followed by Aisha, Shamili, Hemant, and Vanji. Moving on to the 11th question. According to Brisbane classification of liver resection, you have to match the following. On left side, on the right hand side, you will find the liver lobes, okay, which are resected, and on left side, you will find the surgical procedure that is done. So the important thing to note here is anatomical classification of liver lobes. Okay, how do you divide the lobes and segments of liver is a very important PYQ, frequently asked in anatomy. Okay. So anatomy in abdomen, there is only one important question, and that is liver segments. Okay, so if you know liver segments, you can answer this question. Okay, so this is a mixture of surgery and anatomy. Okay, so this is an integration type of question. Okay, so this is the answer, and majority of them have answered it right. So right now, Aisha is leading with the highest, longest streak, that is 926 points, followed by Soumya, Vanji, Ghosh, and Myra. At this point, and the halfway of the quiz, let's review the leaderboard. Sixth place we have Hemant, seventh place we have Yechi, eighth place we have Shamili, ninth place we have Reddy, 10th place Appu, Rakshat, 11th, 12th we have DR, 13th Sanmuga Priyan, 14th RDT, and 15th we have Ashish. So good going, guys. Nine more questions to go. Here is your 12th question of the day. Quick sequential organ failure, that is Q-SOFA scoring, is used for it is used for sepsis. Okay, so for identifying sepsis. So what is the which of this is the correct one? Okay, so on one side you have GCS. Okay, uh, and next you have tachypnea. Okay, altered mental status, and hypertension, that is systolic BP. So you have to match these. Okay. So basically, the question is focused on what are the components of Q-SOFA score, and what is the value of each Q-SOFA scoring. Okay. So I guess this becomes a very easy question because there is nothing to be done, but it's a quick revision for you to know like uh, what is needed, what are the components of Q-SOFA score. So Soumya is leading again. So Aisha is second in position now. Third, Vanji, fourth, Myra, and fifth, Ghost. Moving on to 13th question. What is the primary purpose of surgery? Okay, a basic question. I don't know what type of question it is, and if even if it is a PYQ. So this seems to be like a PSM question. My team has done a great job giving this question to you. So to monitor health conditions, to provide medication, to diagnose diseases, or to treat injuries and diseases. Believe me, guys, in NEET you will come across similar questions also. Okay, so those questions do not make sense. You have to choose the most important. You have to choose the most important, like most logical answer from the given options. Okay, so what is the primary purpose? So crazy neurosurgeon 30 is going crazy right now. So the answer is to treat injuries and diseases. Probably the easiest question among all these. So four participants have crossed 1,000 score. Okay, five participants, six participants have crossed. So Soumya is leading, followed by Aisha, Vanji, and Myra. Moving on to the 14th question. Which of the following is a type of minimally invasive surgery? So I think the answer is straightforward. Thoracotomy, laparoscopy, amputation, or appendectomy. Minimal access surgery is coming up in a big way. Okay. If you see the recent trend in surgery, more focus is towards minimal access surgery because of early discharge, more acceptability. Okay, less like post-operative period. You can recovery time is very quick. That's why there are many fellowships which are coming up for minimal access surgery. And even now, general surgery, open procedures have come down, and minimal access surgeries are coming up in a great way. So this question is mainly focusing on this. Okay, so the answer is laparoscopy. Thoracotomy, if the question is like video assisted thoracotomy, then still you have a chance. Okay, the question was open thoracotomy. Okay, so right now we have Soumya followed by Vanji, Hemant, Yechi, Ghosh, Reddy. Okay. So moving on to the 15th question, five more questions to go, guys. Which factor is critical in pre-operative assessment? Okay. So this is again a general surgery question, also partly anesthesia question. So which factor is critical in pre-operative assessment? So first is patient's emotional state, surgical preferences, personal interest, and medication history. So I guess the answer is to choose the best out of the given four options. Yeah, 15 more seconds to go. Yeah, time is up. Yes, medication history is the most important one because it can affect anesthesia management. Okay. So Soumya is still leading with the longest streak, followed by, sorry, 1G is having the longest streak, but Soumya is leading because Soumya has the quickest fingers, followed by Hemant, Yeji, and Ghost. Okay. Five more questions to go. This is the 16th question. Which one of the following is primary goal during surgery? Okay, so what is the primary goal? So these questions are mainly from general surgery part. Okay, so maintain sterility, improve patient comfort, speed up the process, or minimize anesthesia usage. So you have to identify the most appropriate answer. For participants, kindly note that Dr. RMD YouTube live mentorship session is going on every month. Every month we'll be having 3 to 4 sessions, okay? Around 4 sessions, one session every week, where I'll be discussing with the NEET PG aspirant directly, okay, on a one-to-one basis. You'll be asking me questions and I'll be communicating you through YouTube live. This session happens 4 times in a month. Next session we are having tomorrow, that is at 9 p.m. on 27 January. So whoever has not enrolled, kindly enroll in the membership if you want help in NEET PG INICET guidance. Okay, so Soumya is leading, followed by Vanji, Yechi, and Hemant. Next question is in front of you, which is a common post-operative complication. And the fourth option is it's so funny. So is it clarification, infection, thirst, or boredom? So I don't think you'll get easy options than this. Okay. So yeah. If you want to know about our socials, there are two socials. That is, one is for JuxtaMed and one is for Dr. RMD. For Dr. RMD, you already know about Dr. RMD YouTube channel. There is Dr. RMD Instagram page. There is Dr. RMD WhatsApp channel. There is Dr. RMD NEET PG Guidance Telegram channel. On Telegram, on Twitter, that is X, I'm available as Dr. RMD Official. Okay, so you can approach me through various socials. Okay, the correct answer is infection, and almost everyone has got this right. Soumya is leading the streak, followed by the leaderboard remains the same. So this is your 18th question. Cushing's reflex is a type of, is it a primary brain injury, secondary brain injury, subdural hematoma, or Burnet syndrome? Okay, so what causes Cushing's reflex? For JuxtaMed quiz, we have various socials. That is, we have YouTube channel, which you already know of. Second, we have Instagram page by the med name JuxtaMed quiz. We are on Threads, okay, by name JuxtaMed quiz. We are on Telegram by the name JuxtaMed quiz official. We are on X, that is Twitter, by the name JuxtaMed. We also have a link tree link through which you can access everything. Okay, all the links. So we'll be providing the link in the YouTube that is provided in the YouTube description. Okay, so you can join there. So any updates regarding the quiz will be available on all these socials. Okay, so it's a secondary brain injury. Okay, I think the leaderboards have toppled now, but still Soumya is leading, followed by Hemant, AG, Ghosh, and Vanchi. Okay, last but one question, 19th question of the day. Which of the following is the most common cause of acute pain abdomen in adults? When you go to INICET or if you go to NEET PG, you will see similar questions only. You'll feel like it is so easy, but then you'll be so much baffled at the question because you know that appendicitis is also very common. You know that cholecystitis is also very common. You know that peptic ulcer perforation is less common, but peptic ulcer disease is very, very common. Intestinal obstruction, you can see cases here and there, but questions like this will create a lot of confusion. So unless you have a proper reference or you have gone through this during your entrance exam, it's difficult to crack entrance exam. Okay, so these type of simple questions will make your life difficult during NEET PG. So the answer is appendicitis. Okay, peptic ulcer perforation is very rare. Okay, it's not that common. Okay. So the top five is still the same. Moving on to the last question, out of 50 participants, let's see who has won the quiz. So the 20th question is here. In a patient with ruptured appendix, okay? Remember the thing, ruptured appendix. What is the most important initial step of management? So ruptured appendix is a surgical emergency. So what is the most important? When I say emergency, I think the answer is straightforward. So if it is appendicitis, maybe you can give IV antibiotics, or if it is an intestinal obstruction, you can go for nasogastric compression. You can administer antipyretics only for fever or pain. But the main step is always surgical in something that is ruptured. Okay. So anything that is ruptured, either a ruptured intestines or whether there is acute intestinal obstruction or there is torsion testis or some gangrene that has taken place, the answer remains immediate surgical management. So the answer for this is okay. Answer is IV antibiotics. I'm not sure about this. I'll just confirm with my team. Okay. So let's see the leaderboard right now. So Soumya is leading, and congrats, Soumya. It's a great, great thing. Okay. So like out of these 20 questions, you have almost answered, I think 18 questions, right? But Hemant is the one who has answered with the longest trick. So congrats, Soumya. So at second place, we have Hemant, who has the longest streak. He has answered 19 questions correctly, followed by AG. So drum roll to you, Hemant and AG. Then at third place we have 1G, fifth we have fourth place we have 1G, fifth Ghosh, sixth Reddy, seventh Ashish, eighth Appu, ninth Shamili, and at 10th Aisha, 11th Myra, and 12th Sharmuga Prem. So congrats. So we'll have applause for everyone who have participated in this quiz. Let us know your feedback. Okay. So let us know your feedback. Come back to YouTube live. So we'll be discussing about surgery and other things that are going to happen. Okay. So come back to YouTube live, guys. So let me know in the comment section what is your feedback regarding surgery quiz. Okay. So I think this was a great session. There were 20 questions, and you can see the cutthroat competition that there is. Okay, there is a cutthroat competition. So everyone is behind marks. Okay, so everyone wants to score, and everything is based on timing. It is based on precision. It is based on accuracy. And same thing holds true for NEET PG exam also. Those who are quick in answering, those who are very fast in answering, those who are very precise, those who don't commit any mistakes, those who don't commit mistakes in simple questions, they are the ones who are going to crack NEET PG. Okay. So if you have any doubts, ask in the comment section. So it was, we had total 50 participants who had participated in this. So I think the previous quizzes have helped you a lot. I got so many positive feedbacks in the initial comment section also, and also during the like the quiz first slide, okay, where we had kept the answers open to participants. Okay. So if you have any doubts, we'll see comment section. Tomorrow we are going to start with orthopedics. Timetable for orthopedics I'll be releasing shortly on Telegram group as well as WhatsApp group. Okay. So if you have any doubts, you can ask me right now. Tomorrow, one important notification is tomorrow at 9 p.m. We'll be having Dr. RMD live mentorship session. Those people who are facing difficulty in like making a schedule or maybe learning some subjects. Like there are few people who even after proper like watching my videos couldn't understand how to prepare or how to proceed, or they are facing with many problems. Okay, like everyone faces their situation differently. So most of them will be able to cope up, but there are some people who like need help. Okay, so for those people, I conduct YouTube live mentorship sessions. We conduct 4 sessions in a month. So tomorrow's session is at 9 p.m. For to enroll in this session, you have to go to Dr. RMD YouTube live YouTube channel. Okay, and there you have to click on join button after subscribing. So after that, you'll be redirected to a membership portal, and after that, you can access the live YouTube video at 9 p.m. tomorrow. And tomorrow at 10 p.m. we'll be having orthopedics quiz. Okay, so the timetable for orthopedics quiz will be released by in few minutes. Okay, by 11 o'clock, I'll be releasing the timetable, so you'll be knowing what to study for tomorrow. So if there are any doubts, you can comment. Okay. So Hemant has all are repeated. No, no, all are not repeated questions. We had kept few repeated questions because they are important PYQs. Okay. But rest of them are new questions only. Okay. Yeah, Meredith has pointed it right. First 10 are repeated because we wanted to keep repeatedly ask PYQs important topic, because we can't go very off topic. Okay. Because we know that most of the questions are like PYQs only, which are asked in entrance exam. So there are people who didn't attend daily session. There are few people who will directly attend like grand finale only. For those people, we had kept this one. Okay. So one more thing which I need to ask in the comments is, do you guys want a big cash prize for the quiz? We are planning for a big cash prize in the upcoming session, not for orthopedics. After orthopedics, we'll be having OBG. For OBG quiz, we are for grand finale. We are planning to conduct it as a. We are planning to arrange a big cash prize for that grand finale. If you want a big cash prize and you want the quiz to be taken to different level, please mention in the comments. We'll prepare accordingly. Yeah, popular guide, thank you. It was very helpful. Appreciate for all efforts. Excited for next subjects. Okay. From tomorrow for next 3 days, we'll be having orthopedics, and after that we'll be having OBG. So we are planning to keep OBG grand finale along with the cash prize. Okay. We'll announce the details of this further. If you're interested for like cash prize based quiz, we would also expect a larger participation also. Okay. So because more number of people will be needed, and then we'll be arranging a good cash prize also. So if that is the case, then we'll be proceeding ahead with the normal quizzes. Okay, so popular guy has said yes, we are in. Okay, we take it as a positive feedback. So okay, we'll be arranging a cash prize based quiz for OBG finals. Okay, so that's why I'm telling this now itself, well ahead in advance. So prepare well for OBG. OBG grand finale will be a cash prize based event. Okay, so we expect a good participation for that, and if possible, we'll call some eminent personality to conduct the quiz also. Okay, we'll be having a eminent guest also for conducting OBG grand finale, so that you guys all can get a new approach towards OBG. Okay, so tomorrow we'll be live at 10 p.m. with orthopedics, and at 9 p.m. we'll be having Dr. RMD live mentorship session on YouTube, Dr. RMD channel. Okay, so till then, goodbye, guys. Prepare for orthopedic. Topic for tomorrow's orthopedic I'll be releasing in Telegram group in a while, and also in YouTube. Okay. So anything else you guys want to ask me, you can ask. Yes, Dr. Hema, I have made schedule for rest subjects also. I'll be sharing the schedule link also, like what day to what day we have arranged each subject. I'll be sharing that in the Telegram group of JuxtaMed quiz. Okay. So I'll be sending that also in the quiz along with the timetable for orthopedics. Anything else you need to ask? You can ask us on the Telegram page, okay? On the Telegram page, JuxtaMed quiz, or you can personally text me on my Telegram chat. You can find my Telegram contact from Dr. RMD INICET NEET PG guidance page, okay? So we'll see you tomorrow. Bye. Goodbye till then.